Livestock News, brought to you by Santa Fe Trail Meats in Overbrook, or visit us online at sftmeats.com.
Gretchen, thank you for joining us this morning. Calf scours, we're coming into calving season. It never fails. One calf, two calf, three calves
absolutely.
Are going to get scours.
Correct.
Nothing we can do about it. Well, there's probably a few things we can do about
Right.
it, but it's going to happen. What are your top 5 treatment plans for calves with scours?
Okay. I guess the first thing that I would focus on first and foremost is recognition of it. Certainly a calf with diarrhea is not necessarily an emergency, but you need to recognize when a calf is scouring and recognize when it is sick. And then the next thing you need to kind of recognize is once you notice those calves and you notice that they're sick, is get on top of those calves. And, if they're early on in the disease process, be aware of the oral electrolyte products that are out there. In my research that I did getting ready for this presentation, certainly not all products are the same. I talk a little bit today about Interolytes, one of the ones that kind of covers all the main basic things that we need to have in that electrolyte solution. The other big thing is recognizing when it's out of your hands and you need to call the veterinarian. Because certainly these guys, if they're not responding to oral electrolyte therapy, you need to get on it pretty quick, because these guys can get sick, and they can get sick quick and get to a point where you can't recover them. So certainly there are a lot of IV therapies that veterinarians can do. Obviously, as a producer, it's going to be a little bit harder for you to do those things, but certainly a veterinarian can come out and put in IV catheters and bolus some fluids and get the electrolytes and the acidosis problems that a lot of these calves have, and get those things under control. And then from there, along with the diarrhea, if they get that sick that they're going to need fluids, they're going to need some sort of antibiotic. I tend to go to more of a Ceftiofur product, something like Xanel or Exceed or Naxel. Now, with all the new regulations that are out, you want to be sure that you're following that label to the T. Not using an off-label dosage or an off-label route. So be sure that you're following those things adequately and properly. And then the big thing too is be sure that you're not using any fluoroquinolones off-label as well. And then from there, certainly these calves are dehydrated, and there's risk of NSAID use and possibly overdoing it when they're already dehydrated. But 1 or 2 doses of Banamine certainly is going to help these guys out. They're cramping, they're achy, they're not feeling good. So certainly a dose of Banamine will help them kind of get over that hoop. And then also a lot of these guys, they're septic, they're bacteremic, they've got a break in their blood mucosal barrier, and they can end up getting some of these bacteria in their bloodstream. So that helps with that as well. And then the other big thing that seems simple, but I feel a lot of people kind of forget, is they still need to eat. Obviously, some of these calves are flat out. They're not responsive. So at that point in time, you kind of got to get them over the hoop. But try not to take them off of milk replacer or their dam or normal milk for more than 12 hours. And from there, then you want to try to make sure that they're getting an adequate amount to, one, you need nutrition to get to the intestinal lining to heal that's happened, the damage that's occurred. But it's ideal if they can get at least 12% of their body weight in milk a day. At the bare minimum 10%, and then hopefully get them over that hoop. And certainly if you've got calves that you've treated and you've got them over that hump and they're still not nursing very well, then you need to tube them. You can get to a point where you tube them too much and cause a lot of irritation, but if they haven't eaten in 12 to 24 hours, you need to tube them and you need to get them back on the track. And those are, I guess, my big top 5. I think I said 5 things that you really need to pay attention to. And certainly getting on top of this sooner rather than later is certainly more important than letting it get bad to the point that you're calling the vet out every other day, to IV some calves.